So let's talk about treatment of anaphylaxis. The mainstay of treatment is epinephrine. You give intramuscular epinephrine in the mid outer thigh. About 0.3 to 0.5 ml you inject intramuscularly epinephrine, and you have to repeat that much dose in 2 to 3 minutes depending upon the patient's symptoms. If symptoms are not subsiding, then you can repeat up to 3 doses of intramuscular epinephrine, and if the symptoms are not controlling despite 3 doses of IM epinephrine, then you can start intravenous infusion of epinephrine about 0.1 microgram per kg per minute. If it is 70 kg persons, then it comes to about 7 microgram per minute. You can start epinephrine infusion. And if patient is not regaining hemodynamic stability despite epinephrine infusion, then you can start other vasopressors infusion as well. Okay, so continuous infusion of other vasopressors you can start. And let's suppose patient is on beta blocker for any reason, like for atrial fibrillation or for portal hypertension, prophylaxis of varicose bleeding in portal hypertension. Then if you give epinephrine, what happens that that epinephrine can't bind to the receptor, and the action can't occur. That's why in that case you have to give glucagon. You have to give IV glucagon over 5 minutes. Why I am telling to give over 5 minutes? Because if you give the bolus dose, what happens that patient, it has emetic potential, so patients may have nausea, vomiting. Okay, so give glucagon slowly over 5 minutes. And you also have to give IV NS boluses about 1 to 2 liter if patient has developed hypotension. And there are some adjunctive treatments like antihistaminics, like glucocorticoids. You can give IV diphenhydramine or cetirizine. Diphenhydramine about 50 mg over 3 to 5 minutes you can give, and you can give stat methylprednisolone 125 mg IV. Okay, and after giving these treatments, you have to monitor the patients. You have to monitor the respiratory rate, saturation, SpO2. Okay, you have to monitor blood pressure, pulse.